I've been called to a green job. The MD tells me that I have a 34-year-old female patient with back pain. I've entered into the house, I've checked for safety, and I'm now going to meet with my patient. Hello, I'm Denise from Anderson.
Hello.
What's your name?
My name is Ina.
Hi, Ina. Why did you call us today?
I've got really bad back pain.
You've got back pain. All right. Can you tell me a little bit about this?
Well, I had a car accident about a year ago, and ever since I am suffering back pain.
All right. So it's been something that's been happening for a while?
Yes.
Okay. And do you know what the damage did to your back at that time?
The doctor said it was just tissue damage.
Tissue damage. Okay. And what do you take to make the pain go away?
I usually take ibuprofen twice a day.
Okay. All right. And have you taken it today?
Yes, I think I had breakfast about 9 o'clock.
Okay. So we're looking at about an hour ago. What other medications are you on?
Nothing else.
Nothing else. All right, just going to ask you a series of questions, and then if you don't mind, I'll have a look at your back.
Sure.
Are you allergic to anything?
Not that I know of.
Okay, so you're on no medication other than ibuprofen. You're not allergic to anything. Any past medical history that I need to know?
No, apart from the car accident. Nothing.
Okay, so no osteoporosis, no cancer, no bowel problems at all?
No.
Okay, great. So I'm going to just take a couple of vitals after I've checked your back. Do you mind if I have a look?
That's fine.
Okay. So, can you tell me if it is painful in this region?
Tell me.
That's it. Alright, so we've localized it to the lumbar region. Does it radiate out to the saddle region?
No, it doesn't.
No. What about upwards?
No.
Not into that area at
No.
all? Okay. What about your tummy? It's all good?
No, that's fine.
No headache, no abdominal pain. What about into your legs? Any pain in your legs?
Yes, I've got pain in my left leg today.
Right, okay, so this is a new thing.
That is new, yes.
And do you think it's coming from your back?
I would assume that.
Okay, right. Thank you for that information. I'm just going to take some vital signs. I'm going to take a blood pressure. You've had your blood pressure taken before?
Yes.
Excellent. All right. And everything usually normal? Yes. Right, so blood pressure, pulse oximetry, taking the pulse, and a rest rate. Excellent. So we have a blood pressure of 120/70, a pulse of 80. She is saturating at 99%, the rest of 60, and the last vital sign I'm going to take is her temperature. Let me just take it off your arm. Thank you. Do you mind if I put this in your ear? 36.5. So that is all normal. The vital signs are all normal. Just a couple of more questions. Do you have anything feverish, having rivals at all?
No.
Any weight loss lately?
No.
No? Have you, is your bladder all working well?
Yes.
Toileting well?
Yes, no problem.
Excellent. Eating and drinking?
Okay.
Excellent. Thank you. So the last thing I want to ask you is to walk towards me.
Oh, that hurts.
Is this good? You don't feel dizzy or anything when you do that?
Oh, no.
All right, would you like to return and see? I'm just going to get my paperwork and I'll probably give you something for your pain. I'll get my crew partner to give you some paracetamol. She'll go through all the contraindications with you and just make sure that you can take it, and that should get on top of some of the pain. Have you taken Tramadol before?
Yes, and I don't like that.
You don't like it? Okay. So we won't give you any Tramadol, but you've got ibuprofen, you've got that on board. We're going to give you some paracetamol. Now, because this is an orange flag, with its new onset of pain in the one leg, I'm going to suggest you see your GP. Other than that, your vitals are all normal. I don't see any discoloration or anything wrong with your back. All the other questions that I've asked you, all your history, does not point to any red flags. So is this somebody who could take you to your GP?
Yes, my husband should be home in about 15
Excellent.
minutes.
So do you want to make sense with your doctor? And in the meantime, I will... Alright, so you're going to get paracetamol, you'll be getting that. This is an information sheet about low back pain, because I'm leaving you at home to give you all the stuff you need to know about symptoms, the onset, what to do about it, and if you get those symptoms, who to call. And in addition, I'm going to be writing out a report on what I found and what we talked about, and your vital signs. And you can give this to your doctor too. So, finally, we're going to do a checklist for your, because we're not transporting you, so my crew partner will make sure that it's safe to leave you at home. Are you happy with that?
Thank you.
Thank you. I've been called to a 46-year-old female suffering from headache. Before I entered onto the premises, I checked for scene safety. Hello, I'm Denise from the ambulance. What's your name?
My name is Ina.
Ina, why did you call the ambulance today?
I've got a really bad headache today.
Oh dear, so what were the circumstances? What were you doing when it came on?
I just had breakfast and all of a sudden I felt this headache coming on.
Okay, so was it sudden or was it a slow onset?
I would say it came on slowly.
Slowly. So another question, do you normally suffer from headache?
I get them quite frequently,
okay.
and then I just take some paracetamol and that gets...
Does it feel the normal progression for you?
It started off quite normal,
yes.
and then I took the paracetamol, but that didn't relieve it at all.
Okay, and does the paracetamol normally relieve it?
Yes.
Okay, a few basic questions. What medications are you on?
Oh, I've got this note from my doctor. I'm taking warfarin, betalogan, and omeprazole.
Okay, so the reason you're taking those medications is because?
I had a TIA about 3 years ago, and then the doctor put me on these.
Okay, right. And your past medical history other than the TIA, have you got any
No, not that I'm aware of, no.
So no vascular disease with you or your family?
No.
What about head bleeds of any kind?
No, not that I'm aware of.
Or even in your family?
No.
Have you suffered trauma lately at all?
No.
What about feeling ill? Are you feeling
No, I'm feeling quite okay. Apart from the headache.
So no symptoms of pneumonia or influenza or anything like that?
No.
Okay, great. Have you been vomiting at all?
No, I'm okay.
Okay. And these you wouldn't class. Have you ever had migraines at all?
No, I wouldn't call them migraines.
The last question, are you pregnant?
No, I don't think so.
No, you're not pregnant. Okay, great. So what I would like to do now is take a set of vital signs.
Sure.
Okay. Have you got any drug allergies?
Not that I'm aware of, no.
Okay. So no drug allergies. And you told me your medications. You have no significant past medical history other than your TIA. And I'll take a set of vital signs to see if they're normal. Do you know what your blood pressure is normally?
I've been to the doctor about 3 weeks ago and it was 130/70.
Okay. Alright. So she's saturating at 99% with a pulse of 80. She's got a blood pressure of 125/70, which is all normal. It's in the normal range. The last vital sign I'm going to take is the temperature. Do you mind if I pop it?
No, that's fine. Go ahead.
36.7, so that's normal too. Great. Would you mind if I touched your head and just felt to see if you have anything?
No, that's fine. You can go ahead with it.
It's very important as paramedics that we get permission to touch our patients, especially with some ethnicities they don't like their heads touched. So it's very important that we gain their permission. We good to go?
That's fine.
Excellent. Is it sensitive in any way? Even I'm touching?
No, that's all good.
Okay, put it back down into here.
No, that's fine.
Okay, working towards the middle of your spine. Any sensitivity or altered sensation?
No, that's all good.
Great. If you look at me, do you see double vision or any blurred vision?
No.
None. Are you hearing normally? Yes.
No changes.
Okay. And no altered sense of smell or anything like that?
No, that's all fine.
I think this patient has a GCS of 15 and her vital signs are all normal. She has no previous history of intracranial bleeds or illness of any kind. She's not pregnant, she hasn't suffered trauma, she hasn't been vomiting, she's not ill in any way. It wasn't a sudden onset, so it's a normal progression of the headache. The only reason I would like to take you to hospital is because you're on warfarin, and for us that's an indication that you need to be transported, just in case there's a problem that is brewing. Are you comfortable with that?
Yes.
Excellent. So my crew partner will help you into the ambulance, and they will give you some pain relief. So you've taken paracetamol an hour ago.
Yes.
So I won't be giving you any more paracetamol, but I'd like to give you some ibuprofen and tramadol, provided that none of the contraindications apply, and we might give you some opioid analgesia as well. Okay?
Thank you.
Excellent. I've been called to a 26-year-old female suffering from epistaxis Before I enter into the house, I check for scene safety. Hello, I'm Denise.
Oh, hello.
What's your name?
I'm Ina.
Ina, what's been going on?
Oh, I've been in my office all day and I came out here and wanted to come to see my nose started bleeding.
Oh dear. So you didn't hurt your nose in any way? No trauma to your nose?
No.
Okay. In my primary survey, I've established this patient has an airway and is breathing. However, we need to control this bleed. Ina, I'm going to get you to lean forward.
Sure.
And I'm going to pop a towel on your knees.
Thank you.
Okay? Just take that away. And I want you to compress the soft part of your nose, just in front of that
Right
hard place. Yes, there we go. Nice bit of pressure on there. So by the looks of your towel, you've had a mild nosebleed for the moment.
Okay.
Okay. I'm going to ask you a series of questions.
Sure.
If you don't mind that. Are you on any medications at the moment?
No, I don't take anything.
None at all?
Nothing at all.
Okay. Any past medical history?
No. I haven't.
What about allergies? Any
Not that
allergies?
I'm aware of.
Okay, great. So you haven't had trauma, but you've walked out of the office which has air conditioning?
Yes, but it's
And-
not hot today. I had about 4 hours.
Okay. So has this happened before?
No, the air conditioning is fairly new.
Okay, so this is a new. So what can often happen is the mucosa gets dried out, and so it can actually cause a nosebleed.
I didn't know that.
Right, just to be sure that everything is good, we're going to do some vital signs. First of all, I'd like to take a temperature. Can I pop this in your ear?
Sure.
36.6. Just pop this on your arm. Do you know what your blood pressure is normally?
No, I don't.
But you've been fairly well lately?
Yes, I've been fine.
No, nothing abnormal, not been to hospital
No, I
anywhere?
haven't been sick in ages.
Okay. So I'm now assessing this patient's vital signs. We've got a pulse of 80, blood pressure of 120/70. She's saturating at 99% and her rest rate is 16. So I'm entirely happy that her vital signs are within normal limits. So I've been leaving you there to compress your nose for 15 minutes. I'd like to now check that it's controlled. Okay? So let's just have a look. That looks right. It looks like it's controlled now.
Great.
If I had been unable to control this patient's bleed, I would then have considered applying adrenaline, 1 ml of adrenaline made up to 10 ml with sodium chloride, and using a mucosal atomizing device, I would administer 2 ml into each nostril. If that didn't help, then I would advise, because this is a mild nosebleed, this patient is not on any anticoagulants, I'd advise this patient to see their GP within the next few hours. I'm very happy that your nosebleed has stopped.
Yes.
So I'm going to leave you at home. Are you comfortable with that?
Yes, that's fine.
Right, so I'm going to go through a non-transport list,
Sure.
and just to make sure it's safe for you to stay at home. Once I've done that, I will give you a form, a PRF, that is noted everything down that we've done for you and what we found.
Okay.
But finally, please don't blow your nose,
Okay.
don't have any hot drink, and don't take a hot shower for the next few hours.
Okay.
Just to make sure your nose doesn't
Sure.
bleed again.
Thank you.
Great. Thank you very much, Ina.
Thank you.
This morning we've been called to a 42-year-old female who is in pain and been unable to walk. Before I enter into her home, I check for scene safety and I'm wearing the appropriate protective gear. When I approach my patient, I then did a primary survey, making sure that the airway, breathing and circulation were all right. Hello, I'm Denise from the ambulance. How are you?
Good, thank you.
What's your name?
My name is Ina.
Ina, why did you call the ambulance today?
Well, I've been exercising on my stepping machine over there, and all of a sudden I had this really bad pain and I couldn't walk anymore.
You couldn't walk. Okay. What was it? Sudden onset?
Yeah, it just went bang and there.
Okay. Right. So you were walking and suddenly became painful, and did you come and lie down straight away?
Yeah.
So you mobilized to your bed.
Well, I live from there.
Okay. Now that's all good. Any pain going up your leg, into your thigh area, into your knee?
Not in the knee, no, but it's more on the back side of the calf.
Oh, okay. So it's more towards back, so nothing. What about numbness? Is any tingling?
No.
What about your toes? Can you feel your
Yeah,
toes?
I feel that.
What about about movement? Are you able to pull your foot up?
No.
No, so not even a little bit?
Oh, yeah. It's painful.
Okay, what about down?
No.
No, still painful. Did you hear any sort of noise when that happened?
It was almost like, you know, when you pop a gem jar, like a popping sound?
Oh, okay, so as opposed to like a snapping sound?
Yeah, no, it was more like a gem jar popping.
So at the moment I don't see any swelling or discoloration. Your feet are the same temperature, so I'm quite happy with your limb vitals. So are you allergic to anything at all?
No.
No allergies on any medications?
No.
Past medical history?
No, happy, healthy.
Oh, good for you. Excellent. Alright, so I was going to ask you if you could go onto your tummy because you're complaining that the back of your leg is painful. So let me help you. Okay. Excellent. Alright. So is that painful there?
No, the knees are okay.
So palpating and checking. Is it painful there?
Yes.
Alright, so it's actually quite tight up this part, if I can feel it, it's quite tight. What about coming down here? Okay.
That's very painful.
So what I'm seeing is that I cannot actually see the tension of the Achilles tendon along the back of the foot into the heel, as opposed to the other leg where I can actually see the line of the tendon. Okay, so I'm just going to squeeze this calf. Okay, so I see your foot is moving. I'm going to squeeze this calf too. Yeah, your foot's not moving, so this is the Thompson test to check whether the Achilles heel is still intact. Okay. So I am leaning towards the fact that maybe that Achilles tendon has been damaged in some way.
Okay.
Do you have anybody who could take you into the
No, not really. I'm just moved here, so I don't know anyone.
Okay. So this patient could have gone into the hospital on her own, but if somebody had been able to take her, but because socially she doesn't know anybody, she's just moved into this town, I've decided that I will transport this patient. I'm going to ask Sally, my crew partner, to get a splint ready and to also get some analgesia ready. She is an EMT, so I'm going to ask her to give this patient paracetamol, ibuprofen and tramadol, provided there are no contraindications and provided we have permission from our patient. Okay, Ina, do you want to roll over onto your back? Sure. Okay. So I'm just going to go and grab that splint. I'm going to be applying the splint with my crew partner, but we have adjusted the toe area so that the foot is not at 90 degrees to the ankle. We have allowed it so the toes are in a pointing direction outwards a little bit because that will be most comfortable for a patient with any type of Achilles tendon injury. Once this is on, I'm going to be checking the limb baselines again. I'm going to be looking for the color, the temperature, in comparison to the other foot. I'm looking for a pedal pulse. I can find pedal pulses in both. Once this patient is in the back of the ambulance, we'll be getting a line in. Before we get the patient in the back of the ambulance, I'll put a line in and give them opiates, analgesia, provided there are no contraindications and that I have this patient's permission to do so. Right, so you've now got your splint on. We're now going to get a chair for you and we're going to put you in the ambulance and take you to the ED for further orthopedic assessment. Are you happy with that?
Yes, that would be lovely. Thank you.
Thank you very much.